respected judges, all teachers and all delegates. First of all, good evening all of you. Myself Pushpa and I am here to present a topic, clinical topic, a comparative study of Guglu Chitra Chhar Sutra and Snuya Parmak Chhar Sutra in the management of fistula and neuro, which was supervised by Dr. M.K. Singhi and co-supervised by Dr. Ashok Kumar. Now introduction. Fistula and neuro is one of the difficult surgical diseases in ancient and modern medical sciences of the world. Recurrent nature makes it more and more difficult for treatment. Notorious disease because its anatomical position and high recurrence. Treatment is challenging for the surgeons and restlessness for the sufferer. Need of study, Chhar Sutra, an excellent Ayurvedic remedy for fistula and neuro. An essential component of Chhar Sutra is snowy latex, difficult to procure and preserve, which creates practical problem in the preparation of Chhar Sutra. Upper Chhar Sutra also causes unwanted effect like excessive inflammation, burning and sometimes sensitive reaction also. Hence, further research on Chhar Sutra is a demand of time. Aims and objectives are: first one, to evaluate the efficacy of Guglu Chitra Chhar Sutra in the management of fistula and neuro, and the second one, to compare the efficacy of Guglu Chitra Chhar Sutra with the Snuya Parmak Chhar Sutra. Now, material method. The drugs are Guglu, that is Comifera Mukul, the part used in areas. Chitra, we can see chas, and the part used is Pancham. Haridra, that is used part is Kanda, and in the form of powder. Snuhi, the used part is Chira. Apama, the used part is Panchang. We can see here the prepared Chhar Sutra. Now study design. Randomized single blind controlled clinical trials. Subjects. The study was performed with 30% of lower renal fistula, which were divided into 2 equal groups of 15 patients in each. Selection of patients. All the patients were randomly selected for the OPD of anorectal unit, Department of Shalita Tenai Jaipur, and preliminary investigation were done. Then registered for the present work. Now inclusion criteria. All the patients were between the age group of 18 to 60 years, and patients were selected randomly respective of sex and economical status and educational status and marital status. All diagnosed cases of low renal fistula. Exclusion criteria were patients with fistula and neuro associated with any systematic disease. These are the analytical report of Snuya Parmak Chhar Sutra and Guglu Chitra Chhar Sutra. We can see here that which highlights with analytical report which highlights the pH of Snuya Parmak Chhar Sutra 10.58 and Guglu Chitra Chhar Sutra 10, and dia is approximately same. Now assessment criteria. The subjective criteria, that is pain and itching, and objective criteria, that is tenderness, discharge, unit cutting time. Now periodical observation. I have done periodical observation once in 7 days for changing Chhar Sutra. The changing were done with gradual tightening of the Chhar Sutra until the whole length of the fistula tract was cut through. Follow-up periods 30 to 60 days, once in 15 days after the completion of treatment. Now result. We can see here the result on the basis of assessment criteria like pain, itching, tenderness, pulse, discharge, and UCT also. According to in pain, percentage relief is 90.71% in group A, that is Snuya Parmak Chhar Sutra, and in group D, that is Guglu Chitra Chhar Sutra, 93.01%, and according to P value it shows significant result. In itching, the percentage relief was 90.09% in A group, and in B group 94.09%, and according to P values it shows non-significant result. Then according in tenderness symptom sign, there is a percentage relief 88.8% in group A and 92.48% in group B, and according to P value it is not significant. In pulse discharge, percentage relief 90.61%, and in group B 93.68%. Accordingly, we can say that according to P value not significant, but and according to UCT in group A was 7.44 days per centimeter, and group B was 8.20 days per centimeter. We can see very well. We can see here in percentage form, we can see a result in group T, that is a Google Chitra Chhar Sutra, shows the better result. These are some tips during treatment and after treatment. Now discussion. Great Indian Sir Sushruta narrated in his teaching the use of Chhar Sutra for cure of fistula. The work of Sushruta was later followed by Acharya Chakrapani. In the present study, the experimental Chhar Sutra that was chosen for track of Guglu Chitra Chhar Sutra as a Guglu acts as anti-inflammatory and antibacterial besides good binding agent. It also causes debridement of unhealthy granulation tissue and heals of the tract with healthy granulation tissue by its broader property. Acharya Sushruta has described property of Chitra as Abhyantar Vidrati Nashak, Abhyantar Vidrati Nashak and blood Shrodha, that is in fistula mostly originate from and fistula mostly originate from the endorectal axis. Thus, it clearly indicates Chitra Chhar containing Chhar Sutra drains the suppurated blood and it prohibits further spreading of endorectal axis. According to modern researchers, Plumbagula indica is one of the most important medicinal plants which are used for anti-inflammatory, antimicrobial properties. Now, we concluding all the thesis work. Judicial use of Chhar Sutra by an Ayurvedic surgeon will increase the success rate in treating fistula and On observing the overall effect of the therapy, Guglu Chitra Chhar Sutra was found to be more effective in relieving symptoms like pain, itching, tenderness, and pus discharge. Easily available, preparation material, and cost effective. It can be efficiently used like Simhiya Pamak Chhar Sutra. Guglu Chitra Chhar Sutra can be authenticated in combating this disease with furthermore research work in larger samples. I would like to acknowledge my respected teachers, my seniors, my colleagues and the registered patient. And thank you all for having patience. Thank you. Thank you.
I want to comment on your results slide. Please go back to the results with the different p-values.
Yes, sir?
Yes, I want to show you a trick.
Yes, sir.
You see that you got 4 results which were all consistent. Group B did better than Group A. Okay?
Yes, sir.
You can apply a sign test to all 4 results together.
Yes, sir. I applied.
No, I'm just explaining to you.
Yes, sir.
You looked at t-tests for each one individually, and you found that one was significant.
Yes, sir. I found one significant.
Your attention. Okay. Now, if you look at those results, they are consistent. Okay. So your hypothesis that this B group would do better than the A group, right?
Yes, sir.
Was upheld 4 times, just in terms of the sign of the change. The chance of that happening, the probability of that happening by chance, is 1 in 2 to the 4, which is 1 in 16, which is 0.0625, which is a very good trend. And it's worth adding that to the statistical analysis to show that the trend was definitely in the right direction for all 4 results.
Yes, sir. Sir, actually I applied, for intergroup comparison magnitude test. And for individual, to know the efficacy of individual Chhar Sutra, we applied here Wilcoxon match pairs sign rank test.
Yes.
Yes, sir. And according to p-value, that shows a significant result in pain. But according to percentage, we can see here the better results than group A. B shows get better result in group A according to percentage relief, sir.
You haven't understood what he said. You have to understand. He suggests you to do one more statistical test, examination, in which the trend analysis will show and add to your results that group B shows a better trend than group A. You're not criticizing.
Okay, sir. Thank you, sir. Thank you for your good suggestion, sir. Thank you.
Yeah, but then you must understand it. You must let me explain it to you afterwards.
Please meet him. Understand what is the additional test calculation you are doing.
Okay, sir. Of course, sir. I will meet him. Okay, sir. Thank you, sir.